Hi everybody, it's Honest John again. I wonder if any of you remember Dr. Jack Kevorkian, the physician who became known as Dr. Death because he assisted several terminally ill patients to commit suicide. Now, one of the things that he had working against him was his image, the way he looked. He did not look like a compassionate man. He looked like a mad doctor from the movies. He just looked like a ghoul. But he was very passionate about helping terminally ill patients who were in great pain to end their suffering. Well, physician-assisted suicide got back in the news again when a young girl, 25-year-old girl, Brittany Maynard, with fourth-stage brain cancer, decided to end her life. Now, here's what she had to look forward to. She was experiencing incredible pain in her head and neck. She was having debilitating, lengthy seizures and symptoms that were very similar to what people get when they have a stroke. And things were only going to get worse. There was no cure for her. She only had a few months to live, and those months were going to be hell. But still, a lot of people were critical of her decision. They say that everybody should wait until God calls them, to have the courage to live until God calls them. Well, sometimes God's a little slow on the uptake. I don't know if you've noticed that. Christianity is the predominant religion in this country, but we're supposed to have a separation of church and state. And when people are so devoted to their religion that they lose their compassion, that they can see a person suffering like that, and it doesn't move them, then we shouldn't really spend any time listening to them. Devotion to God, as is rapidly becoming clear all over the world, very often robs people of their humanity. So, religious doctrine should have no effect at all on our laws. The only thing that should decide how a doctor handles a case like that is what is best for the patient. And pain and suffering are not good for the patient. We really don't do a great job of managing pain in this country. Doctors are very reluctant to prescribe opiates, which are the most efficient painkillers, because they fear scrutiny by their medical boards, who look askance and with great suspicion on the prescription of these narcotic drugs, no matter what the circumstances are. And there comes a point when, in order to manage the patient's pain, it's so severe that you would have to put them into a coma. You would have to come very close to killing them anyway. And then there is the Hippocratic Oath, which says, first do no harm. Although those words do not actually appear in the Hippocratic Oath, as it was originally written. There was an injunction against administering poison. But you know, this was simply to keep doctors from becoming involved in palace intrigues. They didn't want doctors poisoning the king. It's interesting that The Hippocratic Oath did not prevent physicians from becoming involved in the Bush torture program. And I don't know about you, but I wouldn't want to be treated by any one of those doctors. So let's take a look at first do no harm. And the question is, does there come a point when keeping a patient alive is harming them? And in a case like Brittany Maynard's, the answer can only be yes. Some doctors think that they should fight death until the very end. It may sound heroic, but it's the patient who's suffering, not the doctor. Where is the morality in keeping someone alive so that they can suffer? If it were me, no law would keep me from ending my pain. I would like to have a physician's help to make sure that I did it successfully, to make sure that I didn't just fuck myself up worse. You know? And I understand the problems some people have with it. You know, there is a potential for people who are simply seriously depressed to want to commit suicide. And of course, guidelines should be set in place so that that doesn't happen. And if it's strictly enforced that it has to be a terminal illness, then I think that can be avoided. And of course, there are advocates for the disabled who are concerned that physician-assisted suicide laws could be used against their patients because maybe their families feel it's too much of a stress to take care of them. So the guidelines for physician-assisted suicide should be very strict. But once you get to the point where you are terminally ill and looking forward to a lot of pain, then every person in every country, in every state, should have the right to determine their own fate. Thanks for listening.